Good morning, everyone. I see some familiar names, part of our Talk Tuesday community rolling in here this morning. Good morning, Anne. Good morning, Kristen. Nice to see you. Thank you all for joining us. We know that lots of districts have professional development happening if they are closed for Election Day. So we may have fewer folks than normal because of that. But as always, we are recording and we will make the slides and the recording available for everybody. So if you have colleagues who are otherwise engaged this morning, not to worry, all of the great content will be shared out with everybody. So I am Caroline Calhoun. I am the professional learning specialist at EdAdvance here in the northwest corner of the state, one of the state's 6 RESCs. And I am joined today by my colleagues, Jaron and Ian, who are managing all of our tech end back support. So thank you, gentlemen, for that. And as always, also joined by Kari Sullivan Custer and Jay Brown, our partners at CSDE. So thank you both for being here, and thank you to everyone for taking some time out of your morning to join Talk Tuesday. If you have not done so already, please go ahead and introduce yourself in the chat. Let us know your role. Today's topic is all about school safety, mental health, crisis response. So we'd love for you to just make a note in the chat about something you might be hoping to learn about that content as we move through the morning. So introductions are welcome as we build our community here at Talk Tuesday. Let's go to the next slide, please, Jaron. So as always, we want to start off with some highlights and happenings around the state. We are pulling from the Superintendent's Digest routinely. It's linked there for you if you'd like to register for that. But CSDE this past week released the results from the last school year Next Generation Accountability System, which offers a comprehensive view of school and district performance across 12 indicators. Many of you are likely familiar with this accountability index, but some really exciting news this year. The results showed that our Connecticut students have improved on most indicators, including academic achievement, chronic absenteeism, hooray, and that 9th grade students are on pace to graduate on time. We've got post-secondary readiness as another indicator, graduation rates, physical fitness, and arts participation. So this is really excellent news. Also, across the state, they use these indicators to identify which schools might have demonstrated high performance or notable academic growth, or maybe substantial improvement. So those schools are recognized as what is termed schools of distinction for excelling in one of these areas, either excelling academically, maybe closing achievement gaps, creating supportive environments where students can thrive. So in this past school year, over 140 schools exactly earned this recognition, which is really incredible, and that included 34 of our alliance districts. So the progress is really notable, and it's taking root across the state, and that is a huge shout out to all of you, because it's the work happening every day on the ground around attendance, engagement, keeping our kids focused and showing up and learning in order to see that progress. So if you're interested in seeing the complete accountability results, seeing a list of the turnaround schools, our focus schools, those schools of distinction, we've linked that there for you. So please feel free to take a look and dig in a little further if you're so inclined. Next slide, please. As always, I have curated an article from the Marshall Memo for your interest and for your review. I've linked the full article there for you, as well as the contact information for both authors. So in a Boston Globe article that was published last month, 2 psychologists really discussed how to support students with anxiety, which I thought was an apropos topic for today's Talk Tuesday session, but also just as we think about the current landscape in schools, I know we have students and families struggling with a number of challenges, whether it has to do with food insecurity and what's happening at the federal level. It might have to do with ICE. Any sort of reason that a child might be experiencing anxiety is certainly front and center, I think, in educators' minds right now. So interestingly, these psychologists were talking about how so often we can find ourselves in the position where a student might be anxious about a particular element of their school day. Maybe it's making oral presentations, maybe it's something socially. And sometimes the schools will recommend that they sort of avoid that particular trigger, so to speak. But these psychologists who are from McLean Hospital and Harvard Med School and Columbia, they really noted that that actually is contrary to psychologists' recommendation and therapy gold standard of exposure therapy, which is really to purposefully face our fears when we are anxious so that students develop the skill set and the awareness that, oh, I can tackle this, I can overcome this particular anxiety. And they really frame it as anxiety can feed on avoidance. So if you're interested in learning a little bit more about this, I encourage you to read the full article and dig into that research, because I think it can really steer how we help support our students who are experiencing anxiety. Next slide, please, Jaren. All right, so new this week, Kari is going to be sharing some frequently asked questions that the state really often hears from folks across the education world. So I'm going to turn it to her to share one of those questions for you today.
Thank you, Caroline. Hi, everyone. It's great to be here today and to see you all here. Happy Election Day. So this is a question that comes up often. I'm sure many of you have heard this. So the situation is a family lets the school know that they'll be out of the country for a few months, or even in the country, but they're leaving for travel. It may not be a vacation, maybe just family travel. The flights are less expensive. This is the time that the family has a tradition that it's time to go for, and they plan to come back. But this particular family said, we're not going to be back until January. But they still live in the district, it's their home. And so what do we do? So I could why don't you go to the next slide, please? So I heard this, I've been on some visits in districts, I hear this a lot, and it's very frustrating. I'm going to acknowledge and have empathy that this is very frustrating because we're working so hard to improve attendance. However, it is really important that we keep the student enrolled in school, that they're not withdrawn just because they're going to be gone for a couple of months. So the answer is pretty straightforward under state policy. The student stays enrolled, we don't withdraw them, even if the travel ends up being several weeks or even months. Those absences are unexcused unless they meet a valid excuse applies. For instance, the first 9 absences are always excused with a parent notification to the school. So they're always excused since family travel isn't one of the valid reasons under Connecticut's attendance policies. And yes, that means that the student should be considered truant if the number of unexcused absences meets the threshold, 4 unexcused in a month or 10 in a school year. So technically, by the state law, they are truant, and they should be every year in June, the PSIS collection, you're asked to indicate if a student is truant or not truant. It's a student level data collection. That student would be considered truant, but that doesn't necessarily mean that we need to make a referral, right, to your community-based organization, your youth service bureau. You could, and that's fine, but it's important to document the absences. You know why the student is absent. You may or may not know exactly when they're coming back, but when they do come back, it's important to schedule a meeting with the family, just like you would with other truant students. So you can meet with them and encourage them to avoid this pattern in the future. The only way we're going to change this behaviors in these choices is if we can meet with families and ask them not to do this every single year, because I know there are families who do this every year, and talk about ways this impacts the student's education, and find ways to keep the student connected to school while they're away, so that when they come back and they return, they're not as far behind as they could be if there was no connections. So sometimes through Google Classroom or learning packets or other options, just to maintain a sense of connection or routine. I know a lot of districts will make sure students are reading while they're away, but so the big takeaway here is don't withdraw, mark unexcused, and stay supportive. It's really about balancing accurate attendance data with a caring approach, because we don't want to, right? It's all about relationships to improve attendance, and we don't want to break down that relationship with the family because they had to make sometimes a difficult decision to take their child out of school for an extended period of time. So keeping a student enrolled during extended travel ensures that they remain connected to the school and continue to have a right to education. It also allows districts you're going to accurately record missed instructional time. So if you took them off the rolls, that missed instructional time is gone. You don't even have that in your records. So this provides a true picture of attendance patterns and helping schools plan for appropriate supports when students return. I also want to suggest, if you have a high level of chronic absence, you're required to have a district attendance team if it's 10% or higher. If it's 15% or higher at a school level, you're required to have a school attendance team. This is an important topic for those teams. The district should have a consistent policy to ensure that the practices are consistent across all schools. So I encourage you to talk to families before the travel is scheduled and the plane tickets are purchased. That could be home visits over the summertime or in the fall with families who have a history of these kinds of travels, or you anticipate these kinds of travels, but they should not be unenrolled from school. In fact, just this could be a future FAQ, but only students can only be unenrolled from school if a parent comes in and signs the paperwork to say that they are transferring or moving out of state or they're homeschooling. Otherwise, you have to continue to keep those students on your rolls. If they're 17, a family can enroll them in adult ed and unenroll them from regular school. And so on the slide, you'll see some resources here: the PSIS reference guide, the guidelines for reporting attendance in the public school system. That is where you will find this guidance. You'll also find some guidance in the guidelines for excused and unexcused absences, and around truancy referrals. There's a Youth Service Bureau referral for truancy guidance that is also very helpful. I believe that that districts can use when they're working with students who are truant and they need some external supports. Sometimes the Youth Service Bureaus are available and there to help you. So that's what I wanted to discuss today. I don't see any questions in the chat. Are there any questions from anyone? Well, okay.
All right. Thank you so much, Kari. I know this is a sticky topic when we think about how to manage these different instances, and really just going back to the state guidance can make it more clear as you work to maintain that relationship, find solutions while keeping the student enrolled. So thank you, Kari, for clarifying that for everybody. If you have a question about this, feel free to drop it in the chat and we can go back to this topic as needed toward the end of the presentation. So let's go to our next slide, please, Jaren. As always, our Connecticut Home Visit Hub, managed by our colleague Nushet Black-Burke at Correct's Home Visit Hub Center. They are staffed by Correct facilitators, coaches. This is part of our LEAP training for 101s. All home visitors are required, but even if you do not receive LEAP funding, anybody is welcome to come to these sessions. They are free, they are virtual, they are 2 hours. They take place monthly, and our next training is coming up on November 12th. So we encourage you to check that out if you would like to learn more about the LEAP home visit philosophy. We welcome everybody. Next slide, please. In addition to those resources that Kari just highlighted for you in the FAQ, as always, we have these at your fingertips on this slide. So everything from our EdSite data portal to bright spots about how high schools have been improving student attendance in Connecticut. Please check these out. They are great resources and tidbits of information for you as you continue this important work. Let's go to our next slide, please, Jaren. I am very happy to introduce to you all today. Our colleague Kate Bohannon is joining us from CSDE. Kate is an associate education consultant. She specializes in school mental health, in suicide prevention, in crisis response, in social work. And Kate also serves on a number of state level committees, including the Connecticut Suicide Advisory Board, the Children's Behavioral Health Advisory Council, and the Transforming Children's Behavioral Health School-Based Subcommittee. So she's also the program manager for the School-Based Diversion Initiative. She's a member of the Trauma-Informed School Mental Health Task Force, as well as a number of other steering committees. So she comes to us this morning with a whole host of expertise, and she received her Master of Social Work from the University of Vermont, and she herself is a licensed master social worker and also holds her 071 school social work certification. So Kate, we are so grateful to have you here with us this morning to talk about this important topic. And I know that all of these mental health needs that our students have and our families have really been forefront of everybody's minds. So we appreciate your expertise this morning. So I will pass you the baton.
Thank you so much. Thank you for having me. Good morning, everyone. I can skip my first slide, which was my intro, because Caroline just gave such a nice introduction there. But she said, my name is Kate Bohannon. Before I joined the State Department of Ed in June 2024, I was a school social worker for over a decade in Connecticut in a few different settings. First, through a youth service bureau, I was an embedded clinician in a number of elementary schools and a middle school. I worked at a special education outplacement for students who struggled with behaviors that made them unsafe for the mainstream setting. And then I also worked in a public middle school and high school. So I bring a wide range of experience here. And my role at CSDE is broadly school mental health. So if we go to the next slide, when trying to describe what I do, so the umbrella term is school mental health, and underneath that can fit a bunch of different things, which I like because that gives me the ability to really adapt and focus on what the needs of our students in schools are. So for this presentation, I was going to highlight three of my sort of different buckets that I assist with: school safety, crisis response, and then connection to resources. So we'll start a little bit about school safety. So for school safety, I collaborate with the Department of Emergency Management and Homeland Security, which is also DEF's, the Department of Emergency Services and People Protection. And I'm on the School Security Working Group, and my role in that really is representing the mental health needs of our students in crisis response and preparation for school safety needs. Just to highlight a couple things, so schools have all hazard school safety and security plans. They were actually due November 1st. So you can kind of read a little bit about that. It's unique to each school and district. There are 15 different standards. There needs to be a school security and safety committee at each school. And it requires that each school provide an orientation to the all hazards plan to each employee at the school. So some of you may be familiar with this. The plan itself is confidential because obviously schools and districts don't want that information to get out there. So it could be used against the safety of the school. That is just something, if you're interested in learning more about what's on your specific plans, I encourage you to talk to your administration. Another thing that's come up a lot in terms of school safety recently is U.S. Immigrations and Customs Enforcement. So last January, CSD, we released guidance to K-12 public schools pertaining to immigration activities. And then also effective July 1st this year, so superintendents must designate at least one administrator at each school to be responsible for interacting with federal immigration authorities. And really, it's best practices for if anyone comes onto your school campus. What is their purpose? Do they have ID? That the documentation they needed. So encouraging schools really just to think about what they're already doing and how to incorporate this new level to that. So again, if you're interested in the specifics for your district and who that administrator is, I encourage you to talk to your teams at your schools. So we can talk a little bit about, should we do questions at the end? Probably, I'm guessing. I don't have any questions, but I know, so we can move along to the crisis response piece, which is really more of my role in school safety. So in thinking of it, I wanted to separate it into some of the supports and services we can offer if there's a school-wide impact for a crisis, but then also with individual students. So starting with the school-wide impact. So the Connecticut State Department of Education, we are part of an interagency crisis response team that can be initiated from the Office of Child Advocate, who gets notification from the chief medical examiner anytime that there is an untimely death of an adolescent or child under the age of 18. That information comes to this interagency partnership, and we work to triage the response to that. So we identify the school or community impacted, and then outreach to let them know who's here and who's available. Those supports are available regardless. We really say that the community defines a crisis. So anytime that your community experiences a death of a student or staff, we've supported communities for school violence or extended lockdown. So even that threat or that worry of violence can be really traumatizing to your students and staff. So what that response can look like, or those supports look like, we work closely with Youth and Adult Mobile Crisis, and you'll hear from some of our friends at Youth Mobile Crisis in a little bit, and the Center for School Safety, who is out of Western Connecticut State University, and they oversee mutual aid regional crisis teams. So we're able to activate those supports to provide additional counseling support for your students and for staff. Oftentimes, staff, their first priority is the kids, obviously, but then also you need to make sure you're taking care of yourself and recognizing when you're being impacted by this loss or crisis as well. We also work closely with the regional suicide advisory boards and can bring in that resource as well as needed, as appropriate. Can do discussions about memorialization, guidance around anniversaries, messaging to the community. We have helped connect folks to additional resources, whether that's a grief PD for your community if you've experienced loss. So those are just a little bit of what we can do in terms of that school-wide impact. For individual students, we're launching two sort of new opportunities this year, one of which is Handle with Care. Handle with Care is a program that started in West Virginia out of some of their drug epidemics. So it was a way for law enforcement and first responders to let schools know if a student witnessed something traumatic the night before. In West Virginia, that was, again, it grew out of the need for students experiencing witnessing overdoses or parental or guardian use. But it is since broadened. So it is a partnership between school districts and law enforcement, and it does not give any confidential information. It's just a way for the law enforcement or first responders to let the school know, hey, handle Kari with care today. And that is sort of the signal word to say they might need a little TLC. They might need just an extra set of eyes or a little bit of understanding. They might need a little more support from the social worker or whoever it might be. It's not asking the school to do anything. It's not asking anybody to talk to the student. It's not asking anybody to reach out to the family. It really is just that heads up. So that's something that we're starting to launch here in Connecticut. I'm working with colleague Deb Fliss at the Office of Early Childhood, and we're starting a community practice around districts and schools who want to implement Handle with Care in their communities and districts. We're starting with a smaller group this year with the idea that we can expand it next year, but this is something that you can start at any time. I can give I'll make sure that I send the link to that information. Again, West Virginia has a ton of resources. They started this. I can send that to Kari and Caroline to include with some resources. Another thing that we're working on this year is a secure messaging system. So this is similar. I mean, most of us have MyChart, right? And you get a notice from your doctor. You can, you get a message from your doctor that your test results are available or whatever it might be. That's something that we're going to launch in a way here in Connecticut, not using MyChart, using another system, but it is a way for, first off, we're starting first with mobile crisis and the urgent crisis centers to share safety plans or after a risk assessment with the school district. Because oftentimes we may not know exactly what the recommendation is. Families are in a crisis mode, so the family might not always think to share that with the school. So it's really just a way to get ahead of that need and to prepare for students' reentry and support as best as possible. That's something that we are hopefully launching later this year. And so keep an eye out on that, but I think that's a really exciting opportunity. The family will have to obviously consent to that messaging system. The way it would work is that the message would go to one mailbox for a school or I think it's each school. And then certain people in that school would have access to it, maybe the administrator and the school nurse. It would really be a closed system. And then they can share that information with who they feel is most appropriate to best support that student. So that's just a little bit about what we can do in terms of crisis response. And then my final piece here. What I can help with too is mental health resources. So when I started at CSDE, for the first 6 months, I just kept saying I had no idea this existed. Right? There are so many supports and services and community partners and resources out there. But when you're working in a school, sometimes it's hard to know where to look, or sometimes you're just crisis after crisis or student after student, and you don't get the opportunity to kind of catch your breath and say, I need some extra support. Who can I bring into this team? So really that's what I've been trying to do a lot of here at the state, is being that bridge between schools and districts and the community resources and supports that are out there. So we've been doing this in a few different ways. This August, I partnered with DCF and we created mental health resource kits. So these blue bags were hand delivered to all K-12 public schools in Connecticut. And they had resources about mobile crisis, Favor, Caroline, care coordination. The third and fourth schools that had third and fourth grades also received copies of Gizmo's Guide to Possum Mental Health, which is an upstream suicide prevention curriculum that's available in both English and Spanish. So a lot of that information, I'm still working on the virtual version of that with all the information, but if you go to the Connecting to Care CT website, that is a great place to find out a lot of information about what's available in the community. There's a really great tool there called the AIM, Assisted Intervention Matching Tool, where you as a school employee or a family can sit down and it goes through some prompted questions, right? What's going on with the youth you're trying to support, and it helps tailor what intervention or what support might be best. There are also regional lists of supports that are available, translated in multiple different languages that you can share with families. So that was a great initiative we had this year. Another thing that some of you may be familiar with, we launched the Student Support Series, Professional Learning for Youth Mental and Behavioral Health. Our first one this year was actually on attendance. Every day counts, improving attendance through connection and care. We work with our partners at Attendance Works. So the Student Support Series is free professional learning once a month, typically the third Thursday of the month from 9 to 10:30 on different topics that are that come up in schools and match the needs of students across the state. So let's see, our next one is November 20th. That's Strengthening School Climate to Support Student Wellbeing. The QR code there will bring you to the registration page. I'm right now working on the winter series. So we're releasing the webinar topics 3 at a time. So we did fall. We're planning for December, January, and February right now, and hoping to have that flyer disseminated in an early December. So you can look out for that. You can find the recordings of the past webinars on CSDE's YouTube channel. There's now a student support series playlist. We are still working out getting these slides available on so you can access them through that playlist in the description of the videos. In the meantime, if you would like a copy of the slides, send me an email. I'm happy to send that along to you. And so then again, just generally what I can help with is connection to resources, whether that's suicide prevention, substance use, that could be curriculum for substance use prevention, or it could be if you have a student who is struggling with inappropriate substance use, how do you get them help? Where do you turn to? Who can you ask? Connection to SEL resources, helping to plan professional development. If you have something that you want to, to cover, I've had districts say, hey, Kate, we need grief. Who can we partner with professional development on grief? Or how can we learn more about the network of care in Connecticut, right? So different things like that, and I can help make those partnerships. And I'm also available as a thought partner as you're thinking about best practices around student mental health. So what does your reentry plan look like if a student has been out for hospitalization or, an outplacement, right? What does that look like to welcome them back into the community? I'm here. I'm here for whatever you might need, really. And I'm just excited to have the opportunity to sort of speak to this audience as well. You're going to hear from our colleagues at Youth Mobile Crisis after me, and they're just a great resource and something that I wasn't fully aware of. Most folks, when you think of Youth Mobile Crisis, you think safety assessment, suicide response, or suicide assessment, something like that. But really, they can be available for so much more than just that moment of crisis. So I'm excited for you to hear more from them next.
Thank you so much, Kate,
Yeah.
and I really appreciate you sharing all of these resources. Let's pause here for a moment to see if folks on the call have questions for Kate, anything follow-up that they would like to learn more about that we can dialogue about prior to shifting to our mobile crisis response team who is on the call. What questions do you have? Feel free to unmute, add to the chat, raise your hand, and I know my fellow hosts will help look for the chat and see what is coming through, as well as who might be coming off mute. It's such an excellent opportunity to have an expert right here to answer questions in real time. So as you listened to all of those resources, as you listened to the different programs that Kate was describing, what was bubbling up for you, coming to mind? Maybe it's a specific case that you are grappling with currently. Maybe it's a certain community feel or something going on in your building that you want to think about. We're here to have that conversation in real time right now. So if you have anything, please feel free to drop it in the chat or unmute. And I see, Kate, thank you for linking that West Virginia Center link in the chat. So questions?
Caroline, this is Kari. I was reflecting this morning with some colleagues about the SNAP assistance and the impact of family who did not get their SNAP cards reloaded. It's been front of mind for many of us, and the mental health and the stress that is causing our families. And doing some thinking and talking with colleagues, that could very well impact a student's attendance given everything that the family might be going through. And so I just wanted to acknowledge that and put that out here. Because one thing I like about Talk Tuesday and meeting every 2 weeks during the school year is we can be sort of flexible and fluid and talk about what the real issues are right now with our families. Um, and just wanted to, if you're a LEAP district or a non-LEAP district but have home visitors, to really reach out to those families who may be impacted by the loss of funding for food, and also encourage, I guess this isn't a question, it's a statement, encourage districts to share with each other if you're doing something innovative or something you want to share about how you're getting food to families and getting and helping them during this difficult time. Please do so. I saw Middletown Public Schools has a food pantry in every one of their schools, and they're sending home grocery bags with their with their elementary school students, I think. So, those partnerships, 211, and making sure families know who to access, especially families who may be afraid to come out into the community because of ICE, or other reasons, to reach out to them. It reminds me of the pandemic when we started LEAP and we went to families to help them. That is very important right now. Don't necessarily wait for families to come to you. If you have the resources and you're able to do it and you know who those families might be, please reach out to them and support them and join your community partners. And remember, 211 is there to help with resources for particular communities.
Thank you, Kari. It's so important to note that. And thank you, Kate. I see you've added some of those resources in the chat. I am not seeing questions coming up right now. So why don't we go ahead? I'm going to introduce our next team of speakers. We are very fortunate this morning to have Melissa Brown, Tracy Smith, and Robert Metzler joining us to talk more about their efforts across the state. So Melissa is a licensed clinical social worker. She has over 15 years of experience supporting children, adolescents, young adults, and families through a whole variety of treatment models. And her work spans diverse settings, including homes, schools, congregate care, community spaces, offices, and she has been part of CHR's Youth Mobile Crisis Team for 5 years, and now she serves as their clinical director. So thank you so much for being here, Melissa. Melissa is also joined by her colleague, Tracy Smith, who is a licensed outreach therapist with the same organization. And she's been with the team for 3 years, but had 14 years experience at CHR. And Tracy really brings a deep knowledge and compassion for families and children to her work, passionate about helping others and finding great fulfillment in supporting the youth and families she serves. So thank you so much to both of you for being here. The last member of our trio here this morning is Robert Metzler, who is a dedicated school social worker in Windsor, Connecticut. And Robert has been in that position for 4 years in education, but has more than a decade in outpatient clinical work. And prior to this role, Robert served as a social worker in a therapeutic program and also held positions in adolescent outreach and worked with the Massachusetts Department of Children and Families. Robert is really bringing to us this morning a deep commitment to developing effective, comprehensive strategies around supporting student success. So we are so happy to have the three of you here to hear from what you are doing on the ground. So I'm going to pass it over to you.
Great, thank you so much. Jaren, could you do next slide, please? Yes, there we go. All right. Hi, everyone. Again, my name is Melissa Brown. I'm a licensed clinical social worker and the clinical program director at Community Health Resources. Today, I'll be talking about how our Youth Mobile Crisis Intervention Services team supports schools in addressing school refusal through timely intervention and collaboration. Here's my contact information on this slide, and feel free to reach out to me after today's session. Next slide, Jaren. So Youth Mobile Crisis is a statewide community-based mental health service for youth. It's available 24 hours a day. 7 days a week, 365 days a year, and it's accessed by calling 211. Importantly, it's free to all youth and families. That means no barriers, regardless of insurance status, citizenship, or even if the family lives out of state. We operate through a network of 6 agencies and 14 sites across Connecticut, and our teams are staffed by licensed clinicians with access to psychiatric consult. Next slide. When a youth is in crisis, we respond rapidly, typically within 45 minutes. Our current statewide average response time is 30 minutes, but it typically hovers between that 25 and 30-minute time. And even just, plug for my team, just this week, we had a 5-minute response time. So that was excellent. It can be quick. So we also offer scheduled responses, which can be coordinated with the family or the school, depending on what's most convenient. Our services include phone support, reassurance, and guidance. We provide biopsychosocial and risk assessments, crisis stabilization, safety planning, typically up to 6 weeks of follow-up care. We also help families link to ongoing services and support so they're not left navigating the system alone after their crisis. Next slide. All right, so school refusal is more than just skipping class. It's often a sign of deeper emotional distress. It can lead to academic decline, social isolation, family conflict, long-term mental health risks, and other needs. Common causes can be anxiety, depression, bullying, academic pressure, family stress, trauma, or grief. And behaviorally, we often see frequent complaints about physical well-being, emotional distress, resistance to morning routines, unexplained absences, or tardiness. So it's really important to start recognizing early signs as soon as you can to intervene. Next slide. So when school refusal becomes a crisis, youth mobile crisis can respond immediately, whether that's in the home or at school. We work collaboratively with school staff and families to develop safety plans and de-escalate emotional or behavioral situations. We also provide a lot of parent training to help parents better support their youth in getting to school. We coordinate with school-based supports and external providers to ensure there's a continuity of care. And we stay involved again for up to 6 weeks typically. And our focus is helping families connect with both clinical and non-clinical resources to support long-term stability. Next slide. All right. So to bring all of this work that we do to life, we have some case examples that Tracy and Robert would like to discuss with you guys. So Tracy will share her perspective on being a responder to a school refusal crisis and kind of what that looks like to work alongside school staff. And we've actually been teaming with Robert for a number of years now. He was previously at Eagle Academy up in Enfield, so we worked with him there, and now in Windsor at Clover Street School. So I will hand it over to Tracy and Robert.
Thank you. Yeah, so I've worked with a lot of kids that have struggled with school refusal, whether it's a parent calling us through 211 in the morning. Sometimes we go out to the home to try to help get the kid to school. We also get a lot of calls to the school with a kid that's struggling with going back to class or just attendance in general. So we've been working with this, and it's become more frequent in the past couple of years, I'd say, that kids are struggling with the school refusal. So when we go out to the homes, we just meet with the family and kind of go over what's going on. And like Melissa had shared, it can be anything from bullying to the anxiety, a behavioral issue, whatever it is, and we help get them connected. So I always offer, when I'm going out to family homes, to set up follow-up visits at the school to help motivate the child to go to school, to meet with them there, to collaborate with the school and see what other supports can be in place. And that's really helpful. And Robert and I have done a lot of collaboration in terms of things like that. And then sometimes we do make referrals to agencies like Favor if a parent is looking for school advocacy, or maybe care coordination if they just want, you know, someone more long-term to help out and do some visits at school, since we are like a short-term program. So Robert and I have recently discussed a child we were working with. He had called through 211 after the child had made like a suicidal statement at school, but the bigger issue was some peer difficulties, some bullying at school, and an issue with another peer. And that resulted in him, you know, taking some time outside of school as well, for a period of time. So I did some follow-up visits with him at school, and I had his dad, you know, sign a release so that I could speak with Robert and provide him updates. We got him back into therapy. And I think he's doing, you know, pretty well now. But that collaboration piece is definitely really important. Being able to communicate and do those follow-up visits at school to keep him at school and keep him doing well there, and you know, addressing those attendance issues and peer issues as well. I don't know if you, Robert, if you want to say something now about our mutual client or past clients that I know you had mentioned someone at Eagle Academy too.
Sure, yeah, I can jump in. I've had a lot of really great opportunities to partner with mobile video. So I think in a couple of examples, Tracy, we've seen honestly is keeping the students in school, and connecting them with resources. So when the student leaves school, there's kind of that continuity, that continued support, and then ultimately creating some of those greater connections outside of ultimately, I think I've tried to work 211 into my protocol, navigating
Are other folks not able to hear Robert? Something's going on with
Yeah.
his audio.
Can you hear me by
Yeah.
chance?
Just going in and out.
I can try and even come back. I'm not sure what's going on.
Let's try that. Good idea. Thank you, Robert. In the meantime, let's have
Sorry.
it's okay. Melissa and Tracy. Are there other examples, anecdotes, sort of tips you could share with folks of how to manage these in the moment decisions and how to reach out to you all? Other case examples you might want to share? I'm just curious about that, like as a former classroom teacher, thinking about those sort of decision junctures as either a teacher or as an administrator, how to proceed. I think that can be really relevant and helpful for our audience.
Yeah, I think a lot of families that have been reaching out to us recently are telling, like, in the mornings, if their kids are refusing to get up and go to school, they'll tell us that they call the school and then the school recommends calling 211, which is great because they might not even think to do that, because like we were saying before, a lot of people, you know, see crisis as like a suicide thing and, you know, that sort of thing. So I think that's really helpful, that, you know, they have us as an option and the schools are helping them with that. I don't know who wants to. Yeah.
No, I mean, I think that the biggest thing is just for families to know that there is a consistent resource for them to use and that we're always available. So we can be available just by phone if families aren't comfortable with us coming out to their home, or, you know, if schools, you know, we get it. Sometimes it's a lot to have us come out. So, you know, we can also follow up with families at home. We tend to get a lot of parents, not a lot, but some parents who are pretty resistant to our services, and maybe there's not really good relationships with the school system. So, you know, we still want to get those referrals. We still want to hear from the schools, and, to be able to connect with that parent and try to figure out, right, like kind of what barrier is going on, what problem exists that's preventing them from accessing, you know, a helpful resource. So I mean, I've spent, you know, I think the longest time I've attempted like outreach and engagement with a parent is, I mean, 2 weeks of, you know, hour-long phone conversations at least 3 or 4 times a week before they agreed to have us come out and do an assessment. And that ended up being a really good partnership with Manchester Public Schools. You know, we got the kid going back to school, and it was just, it takes a lot of work and it takes a lot of consistency. But we do have the time for that. We'll make it. We'll make the time for it. So, and I know like the examples, you know, broad examples Tracy was giving earlier, it just seems so simple what we do, right? Like, it's like, oh, you guys can do that. It really is. We're doing clinical work, and it's very complex needs that these families are presenting with. And so it's very much a case by case, like diving right in there, figuring out where's the family at, you know, how are they going to receive, you know, the support that we can offer, and are they able to receive it? So it's really just kind of going based off of their needs that we're assessing at that first contact and ongoing. So
Yeah, and more of a specific case, we've been working with a family about 2 years now
Yeah.
with one particular child that really hasn't gone to school. She was in a it was a very like traumatic event that she went through and kind of wasn't able to get back to school after it. And she's now, after some time,
yeah,
is going to school consistently, which is really great. And I see her, she was a case that I'm able to keep open longer. So I meet her, you know, we have our Friday school visit that she really looks forward to. So,
and that is
Yeah.
one of kind of her motivators for continuing to go to school, is knowing that she has her follow-up visit with Tracy every Friday. So like that is a piece that, like, when we're not allowed to get into the schools to do the follow-up visits, that does hinder our ability to support kids' engagement and attendance. So, you know, it for this youth in particular, it was very critical for us to be able to continue providing that follow-up. And we've also worked with this youth across multiple districts at this point.
Yeah.
So there's that too.
Yeah. And another thing that's helpful in the morning, sometimes schools will actually go out to the house and then they call through 211, like whether it's the social worker or maybe a particular staff member that this student has like a good relationship with. So we've seen some of that too. And that just helps, you know, the child know that everyone's in their corner and, you know, there for them. So that can be really helpful.
Thank you both. Listening to you, it just, you know, it keeps coming back in my mind about sort of the basics of these human relationships and the need for collaboration, for trust, for the persistence required in some of the cases that you all are managing, as well as that consistency to build those sort of positive attributes over time as you develop this relationship with the family, with the student. So I really appreciate you all sharing that. Robert, I see that you are back.
Yes.
It sounds like your audio is working.
Much better. So I'm so sorry about that. The
my gosh.
technology
No
is always a
worries.
good time.
Get it.
And I just want to echo, I'm sure they've probably talked about some of this already and echo some of the things I just heard. I do see that making these connections, and especially in how they create kind of that home community school kind of combination. I think the kids really see and appreciate that. I have had students who specifically, as a matter of fact, for Tracy, have asked for her specifically over a number of days, waiting for their check-in, so excited to do that follow-up. But to me, as a school staff member, that creates a sense of excitement for me in that my students that I'm working with, that I'm trying to figure out how to help them get through the school day, are getting this extra relationship that also will benefit their access to supports outside of our building. You know, we only see these kids for this stretch of time during the day and among all the other demands that they have, but creating those community connections, I think, is extremely important, and having mobile crisis be an important part of that. I was saying it before my internet decided to cut out, that I work 211 and mobile crisis into my protocol for managing a whole host of issues. So almost like my flow chart, as a part of that process is always at some point a 211 contact to start to create that bridge and that support system. So I think it's an extremely important facet to getting our kids the support they need, not just in the moment, but ongoing, and making sure that those supports are there for them when they need them in the future.
Thank you, Robert. I've heard all three of you really talk about two different pieces, the school refusal and anxiety as sort of frequent reasons that you all might be called into a situation. Are there particular go-to strategies you all have in your back pocket that you can share with the audience when you are working with a student or a family that is experiencing either of those frequent reasons that you cited?
I mean, I can at least talk to what I do. Obviously, I think school refusal, attendance issues, especially when they're related to anxiety, is really complex and challenging. I think understanding kind of some of those underlying factors, and I think some of them may not always be super clear or transparent initially, right? When we're talking about peer issues, right? Kids may not want to talk about them, but again, getting them connected with outside support, giving them a chance to work through and understand that, I think is super important. For me as well, I think understanding from the parents' perspective and creating connection with them around what it looks like to get them out the door, how challenging it might be to maybe get them out of bed, and talking them through or figuring out ways to help support, them in creating that routine or process of getting them to school. And then of course involving my friends at Mobile Crisis if it's beyond my reach. I'm certainly not afraid to do a home visit, but I think utilizing the resources we have that are available to all of us to their maximum potential. That way we can get these kids in school and get them more help. I think is super important.
Thank you, Robert. Kari, I see you have your hand up.
Yes, Robert, I love the way you have that protocol and the steps that you take in 211 as part of your protocol. Question I have for you is I get a lot of calls and I know school districts and principals and others have frustration with families who aren't coming to school and they're ready to call DCF. And DCF is part of the protocol, right? Especially, and it should be, especially if you're worried about the child's concern, well-being and safety, or if there might be neglect issues. But I wonder if in messaging, if it would make sense to message more often to calls that I might get or others might hear to have you call 211. Right? I'm ready to call DCF, but have you spoken to 211 to see if they can support the family? Right. But do you need the family's permission to contact 211 though, right?
You don't have to have their permission to do that. So anyone with a concern about a child can call in for 211 and make a referral. So it could be a non-mobile referral, which means that you're just looking for 211 to reach out. What I'll add though is that it, best practice is to give the family the heads up and say, hey, I made this referral, or are you okay with that? Or right to you want to ask permission, but it doesn't prevent you from whether they agree or not doesn't prevent you from actually calling us. And
you might also be able to just support the district as well and have what next steps to take, right?
There's at times, when schools will call us out during the school day and they can't get in touch with the family. We're still going to come out. We're going to provide a response. We're going to assess that child, and we're going to support the school staff involved until that parent tells us no. So at the point the parent says, no, I don't want you here. I don't want you talking to my child. We'll stop talking to the child, but we're still going to support the school staff. Because what you guys are managing, everyone involved is kind of in a crisis. So we're doing our best too to help the adults, provide care to that child, even if we can't talk to the child.
Mm-hmm. And I will say too, I think a lot of parents are kind of scratching their heads and are just not sure what to do. I loved that prior to us speaking that Kate was talking, and I saw at the bottom the link for the family referral form for chronic absenteeism, because again, instead of just jumping straight to DCF or making referrals for school refusal, because their hands are tied as well. I think one of the most helpful suggestions I got along the way was, hey, these resources are here. Let's tap into them before we jump to that DCF involvement component, because obviously that has a huge impact on the school-family relationship, and trying to preserve that as much as possible and using the resources we have to do that, I think really carries through, when you have these kids with you for a number of years over and over.
And of course, the youth service bureaus in the communities that have them can be a tremendous asset for working with students who are not coming to school and their families.
Let me jump in real quick on that conversation with the DCF piece, because that is really tricky. And I think before going to that sort of punitive or discipline, it feels disciplinary to families to call DCF, encouraging families to utilize other supports like a care coordination, what used to be called voluntary services for DCF, and really trying to reframe DCF as a resource, because DCF, people just think of the CPS, the child protective side, but DCF holds the behavioral health contract for students in Connecticut. So they have a wealth of other supports and services and connections. And so to try to reframe DCF as a partner, as opposed to sort of the attendance police, I think could be really helpful for families, because they don't understand that. And I know that's something that DCF as an agency is also trying to change that public perception.
Thank you, Kate. That's such an important point, to think of the partnership and the resources available as opposed to that sort of punitive feel you noted. I'm looking at the time. It is 11 o'clock. I've seen some comments coming through in the chat, folks asking questions, other people answering, thinking about some of these topics. So thank you for joining that. If we just go to our last slide, Jaren, I think we have a note about next time. We are gathering on November 18th. We will be discussing Tier 2 interventions with some colleagues from EastCon and from the ACT Magnet School to hear about their on-the-ground practices. But thank you so much to Kate and to Melissa and Tracy and Robert for sharing your expertise this morning. It is really helpful and important work. We really appreciate you all. And to participants, please reach out if you have any questions. We will include the resources you all shared in the chat in our follow-up email along with the slides. So thank you again to our presenters, and I hope everybody has a great rest of their Tuesday. Take care.